Okay. We've established how important it is that the emergency room is. I want to share with you that when I was trying to figure out what was going on with me, and for those who don't know, I was diagnosed with lung cancer several years ago, beat the battle, and then it metastasized to my brain. But I knew none of this. All I knew is that I had laid in the basement for 6 months and was going to every doctor I possibly could. And I ended up going to an eye doctor, and he said, I want you to go to the emergency room immediately. So I went to the emergency room, and we sat there late that evening. So when you tell me about getting your records and all this kind of stuff, they were trying to find my records and do all these things. And so then they gave me some kind of nasal spray that I squirted in my nose, and it numbed my brain. But because I was somewhat learned or learning how to heal myself, I said, this is a Band-Aid on the situation. And they were getting ready to send me home. And I just knew something wasn't right. And then they tried to load me up with some other drugs, and I said, no, something's not right. And so because I also dealt with natural medicines and natural food products and these kind of things, I would like you to talk about, from a physician's standpoint, the difference between synthetic medication or synthetic medicines and then food that comes from the earth, medical food that comes from the earth. And that is a term, my friends, if you can, please.
So let me take this broad scope of emergency medicine and understand exactly, or trying to understand exactly, your emotions sitting in that emergency room, waiting, knowing something is wrong, scared, looking for help. And I think what I'd like to propose is that we don't look at the individual for that potential diagnosis, but we look at the individual from afar as an individual who is a human being, who may have a physical problem, but comes with a history. Your wife may be beside you, your kids are beside you, you bring her historical perspective to the emergency room as to who you are. And that historical perspective involves multiple facets of who you are.
Okay.
Who you are spiritually, who you are medically, who you are personally.
Okay.
So if you bring forth a different way or a more expanded way of dealing with the individual patient as a spiritual being, as an emotional being who has a history, then you have to look at all facets of what you can provide that individual in order to heal them. Comfort, make him feel at ease, empathy, information, all that becomes part of the healing process. And that healing process has to do with the fact that we have a history in medicine. It's developed, it's evolved. It's evolved based on our current understanding of science.
Okay.
It's evolved based on our current understanding of healings that occurred thousands of years ago, well accepted. And we need to bring that to the forefront and include that in part of our healing or choices of healing. There's no doubt that the development of the American Chemical Society, development of drug companies, have brought forth an entire array of life-saving synthetic medications. But let's not forget where we came from.
Right.
We have lived many years based on healers from thousands and thousands of years ago, from Chinese healers, from shaman, from cross-cultural areas that we need to accept as what has been naturally, before the test tube, before the laboratories and the Bunsen burners, before the chemical analysis and MRIs and so forth. There were healers that were using natural earth products to heal specific illnesses.
All right, there's a television show. They don't run it anymore. It's called The Twilight Zone. And in The Twilight Zone, somebody like myself would have an experience with someone who was in a profession, and they would say truth like you're speaking, but it would be funny. And I want to let you know, this is like an out-of-body experience because, and I'm being funny, but at the same time very honest, because you're actually expounding, you're actually saying, look, the medical system used to deal with homeopathic, they used to deal with naturopathic medicine, and you're actually, as a physician, saying that we need to go back to some of those ways, man, because what if I hear you saying, we've evolved from dealing with the earth to pharmaceuticals. When you say, I think that's what you're saying.
Correct.
When you say science, you're saying we've gone just basically chemicals, and there are benefits from things from the earth. Wow. I get that.
We need to understand where they came from, understand the history, understand the fact that these were probably natural products that were made so that we can heal ourselves without the side effects of potential synthetic products that
Right.
exist today.
Right.
And if you listen to a commercial today, you'll listen to 30 seconds of how this medicine can kill you. You need to tell your doctor about it and says, here it is. Ask your doctor to give it to you.
Right. And you know, and for those who are watching and listening, I want you guys to understand, I don't know everything, but I can just tell you this, because of what I have had to go through with inflammation, and I turmeric, I do that 3 times a day, and it has helped me. And there's some other things that we'll get to in later episodes, but these things I take alongside with the medicine, because I'm not going to demonize medication. I'm not doing that. But at the same time, I just want you to know it's refreshing to hear a doctor say, hey, listen, we need to return to some of this. What I'd like to do, if we can, I think we've covered this. I would like to just take a quick moment, take a break. I want to gather myself. And I just want to come right back. Really, I got to use the bathroom, y'all. I want to come right back, and I want to talk about something that I have had to deal with. And I want to hear your take, your medical take on this internal thing that we all go through. Just know this, you definitely want to listen to the next part of what we're going to talk about. It is going to help you have a good day. The clouds are going to leave. My name is Deron Cloud. I love you, and I beat you to it. This is the new ministry of health. Okay, how are you doing? I was just thinking about how I was going to segue into the next part, and as soon as I looked down, I saw my note cards, and it made a lot of sense. As I said, Dr. Henri, it's really refreshing to hear your take, because I don't get to hear physicians often talk like this. And so to hear your take on healthcare and wellness. But one of the things I want to just quickly pinpoint, you were talking about the care of a physician, and you expounded on it. And it triggered me. If you say you have to listen to the patient and you have to hear what's going on, are you saying, because this is what I believe, and I think it's been shown that we have a lot of major problems, so we believe, but a vast majority of them are connected to emotional health, or our lack of emotional health, or our emotional health being tended to. Would you agree to that?
Absolutely.
Why?
Because it's part of who you are.
Okay.
It's part of what brings forth illness processes, symptoms processes that needs to be accepted by the physician who's gathering data to better understand who you are.
Right.
Your emotional health, your spiritual health, your physical health is all part of who you are. And let's not forget that what I need to bring to you is A, understanding of those three concepts of who you are, and B, understanding that my tools are not just about the newest synthetic chemicals. It should also encompass the very, very long accepted practice utilizing what comes from the earth.
And so, and the reason I say that is because I know, and I don't like to say that I've been to an emergency room several times because it's an adventure and it could be daunting and terrifying at times. But when you go there, you learn all of this information, and it felt so good when someone would sit down and talk with me. The question I have now also, or not just a question, I think that what we're going to be doing, and I want to talk to you guys to understand, we're going to be uniting everyone. This bless you. This MMRO is about uniting everyone and bringing everybody back together. I came up, well, I'll just say this, MMRO, My Medical Records Online, or MMRO, is a moral choice because it gives me control in my life to know what was going on. And again, I appreciate everything that you're saying in terms of care, because I felt like sometimes when I came to some places, there was no care. And they was just saying, all right, this, and this, and then they leave, and you're like, what am I to do? And so when you talk about this medical concierge thing, are you saying that a patient would have an opportunity? And let me just be really honest, and I want you guys to hear this. I may be very calm right now, and I'm doing everything I can to hold back my emotions and my tears, because I'm experiencing, as I talk about this, I have to go back to that emergency room, and I want to have my wife come up in a second, because I want to talk about the perspective of her. But that we had an emergency room visit one night, Dr. Henri, and I went there and I was in severe pain, and I knew. They sent me, as I was saying in that last segment, they gave me this nasal spray, and I had to catch an Uber home. And my wife was walking all downtown in Baltimore, where it was a drug place to find, because you couldn't find a car. And it was just so much happening. And I was just so upset. And they sent me home. And so I go home, and then as soon as I get home, the doctor who sent me to the emergency room says to me, go back immediately. And he makes a call to the head of the hospital to say, take care of this man. Take care of him. And I cried. And you know why I cried? Because I said, I'm doing the best I can to take care of my health. And I keep running into this. And so when you tell me that we will have a system, and that there'll be a medical system that gives me control to be able to have a better experience, I want you to know that it brings, a lot of warmth to me, and it brings a lot of comfort to me, because I don't want anybody to have to go through that terror. And let me tell you, and I want y'all to hear this. I can't explain you the terror of being released from the emergency room, having to sit outside in the hood of a hospital in a wheelchair. You can't defend yourself, and you can't go help your wife, and you're shut down, and then have to do it all over again the very next day. It's very stressful, and it leads to depression. And so I don't know if that was supposed to be the topic that we were going to go to, but I'll ask you, and I'll forget it, I'll just say it. It led to me being depressed. Can we talk about that just for a second?
Absolutely. But I think we need to understand that there has to be a paradigm shift here. We can't sit back and think the current system is 100%. It isn't.
Okay.
There are flaws,
Okay.
no doubt.
Okay.
We can improve.
Okay.
We just have to think outside the box and make it happen.
Right.
The emergency room visit should not have an end. It should have a continuation. It should have a journey. It should have a history.
Right.
It shouldn't stop. So what you need to bring to the forefront is not just taking care of you in the emergent process, but taking care of you when you walk out the exit door.
Right.
You didn't sign the last chapter of your book.
Right.
You opened up your chapter of a healing process that will entail communication, someone to take care of you after you leave the emergency room, someone to make sure that you have at least the appointment necessary, your medications are filled, a concierge program that takes care of you as you enter back into the community, back into the different realms of what's acceptable for you and what's available for you medically. Right. So that process in and of itself is lacking. And if it's lacking now, it leads you to exactly the state of mind that you've talked about. Right. Unfortunately, when you're in pain, hurt, confused, worried about your life, it's not just you. It's you, your family members, your cousins. It's lots of individuals. Right. And you're the patient that needs to have the empathetic care beyond just the emergency room visit.
Right.
And then when you don't have that, unfortunately, when you face the wall that you can't climb anymore after trying to climb it, you become extremely disappointed, disillusioned, distant, sad, depressed.
Yeah.
And that depression is real. It's real for any individual who comes in and feel like, I came in, this is 2019, and I'm left with something that I can't understand, don't have any answers to, and where am I to go? So let's accept the fact that the system now does not have a process that involves a community outreach, the
Right.
community information system, the community that tells you, by the way, you should know what's in your emergency room, so in
Right.
case you need to access it, this is what you need to do.
Right.
And once you access it, we're not going to drop you when you leave. You don't sign the paper and say, time out, you're gone. You sign the paper and says, I've signed into a medical delivery system that will take care of me after I leave the emergency department.
And you know what? All I can tell you is sitting in that wheelchair at 3 o'clock in the morning, and all I did was sign some paper, and I was gone, and I didn't know what to do after that. And so I want you all to hear, I'm not a pitch man. I made this statement. I went into the hospital with a life and a plan. I came out with life, but I had no plan. And I didn't really think I had life. And it would have helped if someone could have, if I could have chatted and spoke with someone just to say, and I'm not talking about a therapist. Can you explain to me what's the next step? What should I do here? Because now I have to now, in my pain, now go back online and try to figure out how I'm going to take care of myself to do this. So I really appreciate what it is that you are bringing.
That's why we need to deliver a very comprehensive system of healthcare,
Right.
a broad-based system of healthcare, a multifactorial system of healthcare that goes beyond what we're doing today, because what we're doing today is not working for everyone.
We know that's sure. Well, look, hey, I appreciate you taking the time to talk with me and being a part of this organic process. I thank you all for listening to sounds and all this kind of stuff. But if you really heard anything, what you heard was truth. What you heard was some things that you can do to take care of yourself, because you come first. And if you come first, then take this information, do something with it. Get in touch with us. You'll see some information on the screen, and actually you'll see some on the actual website. Hey, this is the New Ministry of Health. My name is Deron Cloud, and I want to thank Dr. Henri Lamothe for showing up.
Oh, you're quite welcome, Deron.
Thank you, my friend.
Good to see you.
We'll talk to you soon. Much love.